So today we have a NG tube insertion that's going to be performed on this patient in here. So what you want to do first is you want to check your doctor's orders just to verify what you're going to be doing. Which the doctor has ordered a NG tube for this patient. It is a 75 centimeter in length NG tube. It is 16 French and it is going to be used for suction. So what you want to do first is you want to gather all your supplies, which have a towel, the NG tube, the tape, some gloves, my lube, and my stethoscope. So now we're ready to go into the patient's room, so you would implement your standard protocol. So,
hello.
Hi, how are you doing today?
I'm alright.
Good, good. My name is Eric. I'm going to be your nurse today. So I'm going to go ahead and come in the room. I'm going to perform my hand hygiene and wash my hands. And then could you just please verify your name and date of birth for me, please?
Bugs Bunny.
Bugs Bunny, nice to meet you. Awesome. And then, do you have any known allergies that I need to know about?
No allergies.
Okay, awesome. And then, have you ever had an NG tube before?
No.
Okay. Well, the doctor has ordered your NG tube. We're just going to recheck that along with the MAR. And that all matches with the patient, so that's good to go. So I already washed my hands. So we're going to go ahead and first lay this towel on here, right here, just in case any secretions happen to come out. So for the NG tube insertion, you want to raise the patient's bed to high Fowler's position. We're just going to move your bed up a little bit, Mr. Bunny. So just a little bit more, right about there probably. So what we're going to do first is we're going to measure the NG tube. Not doing that first. We're going to assess the nares for its patency. So we're just going to take a quick look on each side. There's no occlusions either nair, no deviation from septum. We're just going to go ahead and go in your left nair if that's okay because it's closer to me. So now we're going to go ahead and measure this out. So what you want to do is you want to take the tip of your NG tube and start at the nose, loop it behind the ear. Then you want to go down to the xiphoid process, which is right out here. So you're going to want to mark this with tape or a marker. I'm going to specifically use tape right here. So that's good. So after that, we're going to go, that's all measured out. We're going to go ahead and wash our hands one more time, and then we're going to go ahead and put our gloves on. So the first thing we're going to do after this is we're going to lubricate the end of our NG tube with our lubricant, which is right here. You're going to lubricate about 4 inches. So just going to lube that up. That's good to go. 4 inches. So when inserting the NG tube, you want to make sure that it's facing downward, not away from you, but towards the patient's nose. So you're going to go ahead and let the patient know that the procedure is about to begin. You want to ask them to lean their head back, and then you're going to enhance the NG tube into the patient's nose. After you're going to just advance a little bit. Then you're going to grab your pen light or some type of light where you can check the back of the mouth to make sure there's no coiling, which there is not. That looks good. So now you're going to want to go ahead and let your patient sip a few sips of water in order to help with the insertion. So you're going to want to ask the patient to lean their head forward while inserting the NG tube as the patient drinks the water. And if any gagging occurs, you would stop the NG tube and then take it out a little bit and then advance it when the patient is ready. So you're going to keep advancing as he drinks until it gets to the tape line, which is right about there. So you're going to want to temporarily tape it to the side of his cheek in order to check the placement of the NG tube. So the first thing you would do is you would ask the patient to speak. Okay. Then you would check the back of the pharynx for coiling, which there is no coiling. Now what you want to do is grab your intermittent suction, and you're going to want to aspirate to check the gastric secretions. They should be about yellow to brown, so you would go ahead and pull up. I'm going to pull up about 15. So I'm observing the gastric secretions. It is a green-yellow type content. So next what you would want to do is you would want to listen to the abdomen for a whooshing sound while reinserting. So you would just get underneath. And with your stethoscope, you want to listen to the abdomen, which you should hear a swishing sound. Slowly inject the secretions back in. And I do hear a swishing sound, so that is verifying the placement of the tube. And some hospital policies require you to do a pH test, so you would test the secretions of the pH test in order to also verify the placement. but one of the more reliable ways to do it is you would have the patient do a chest x-ray, which could definitely ensure that it is in the right place. So now that this is hooked up, the intermittent section, I'm going to go ahead and anchor my NG tube. So you're going to anchor it to the patient's nose. You're going to put that there, so that looks good. So now what we're going to do is we're going to slip knot a rubber band tie onto the NG tube and tie it to the, or pin it to the patient's gown. So you're going to slip knot it, just like that. Then you're going to go ahead and do this. And you want to pin it to the patient's gown. You want to make sure that there's enough room to where the patient can move his head freely, which he looks like he can, so that's good to go. I'm going to put this here and tuck it back in. So now I'm going to wash my hands and I'm going to perform hand hygiene. Then I would go ahead and document the procedure that was done. I would document the date, the time, the type of the NG tube, the size of the NG tube, the French, so it would be 16 French, the intake and output of the patient, how the patient took the procedure, and the patient teaching that I taught him, which I would tell him to not yank on it, and I would teach him to, if he had any questions about it, to be able to call me. So what you would have to do next is you would have to irrigate the NG tube, which you would usually do in 2 to 3 hours. But I'm going to assume that 2 hours passed, so I would implement standard protocol once again. Knock on the patient's door. I would wash my hands, perform hand hygiene, put on my gloves again. So before injecting the normal saline, you would want to verify the placement of your NG tube once again. So what I would do again is I would aspirate for the gastric secretions, which they are once again yellow and green. So it looks good. And I'm going to go ahead and listen to his abdomen again, which I should hear a whooshing sound. So we're going to put that under, have a quick listen. Push in the secretion. I do hear a whooshing sound, so that would verify the placement of the NG tube. So what I would have to do next, is this is normal saline, and you want to flush it with about 30 milliliters of normal saline, or some type of sterile water. Okay, that's good. So we're going to go ahead and disconnect the intermittent suction, and we're going to go ahead and flush his NG tube with our normal saline, our 30 milliliters. So we're just going to go ahead and slowly inject, flushing it, making sure that it's coming down. Slowly.
You need to take these away from me.
That's good. Alright, so now that this is done, we're going to go ahead and reconnect his intermittent suction and just ensure that everything is still taken down well, the patient is doing okay. So I would wash my hands again, and now I would document my findings. So I would once again document the date, the time, the intake and output of the patient, any of the discharge that came from the NG tube, the volume that was discharged, the description, what color it was, the consistency of it. I would document the length, the type, and the reason for the NG tube, and I would document my patient teaching and how the patient took the procedure.